Good afternoon, everybody. Thanks so much for joining us here on this beautiful afternoon. It really is lovely out. My name is Katie Earle. I'm the coordinator of the University Express program. And we're joined here virtually with Beth Nelson from New York Statewide Senator Senior Action Council, Medicare Patrol. Goodness, if I could talk today, that'd be great. We appreciate you being here, Beth. And everyone who's on, welcome. Quick housekeeping here. We are recording this session and I'll try to post it on our website in the near future. If you have any questions for Beth, we're using our chat feature today. So feel free to type any questions and comments you have in the chat. You'll find them the lower right-hand side of your screen. If you're on a computer or a tablet or smartphone, touch your screen. That'll bring up your control panel and you see the chat. Beth has already put a link to a survey in there that she'll talk a little bit more about, but that's what's hanging in there right now. So I'd like to thank the sponsors of our program, which is my Department of Senior Services, Blue Cross Blue Shield of Western New York, Excelsior Orthopedics, and Wegmans for their support. And I want to let you know that Senior Services is here. If you have any questions about program services, even if you're not sure what you're looking for, give us a call. We're at 858-8526. Now I will introduce our speaker to you. Beth Nelson has numerous years of experience working with the senior population, specifically as a service coordinator in HUD subsidized housing. Beth also worked as a case manager in the Erie County Department of Senior Services and their cluster offices in Amherst and South Buffalo. She currently serves as the director of the New York State Senior Medicare Patrol, and she's here with us today. Beth, thank you. The floor is yours.
Thank you, Katie. I appreciate it. Thank you for having me in as a guest speaker. I always enjoy talking with this group. As Katie said, I am the director of the New York State Senior Medicare Patrol. This is a federal grant from the Administration on Community Living, otherwise known as ACL. And our job is to go out and educate the community about Medicare fraud, how to prevent, detect, and report it. Today, we're going to talk about protecting your healthcare identity, and we're going to talk about the latest healthcare scams. And I'm supposed to be flipping my pages, so be patient. I will. There we go. I was really worried it wasn't going to work. All right. So what I want to talk to you a little bit about is this commercial, and I'm going to skip it because I know you can't hear it. So I'm hoping I can go to the next page. And I don't think I can. I think I'd have to. Hold on. How are we going to stop this? You can't
Try your arrow keys. Nope, we can't hear it. Use your arrow key on your keyboard.
I can't stop it.
There we go.
So I'm trying to get out of this because I don't know how to stop this. I wonder if I can. Hold on. Let me go back to what I was doing. And I'm just going to have to blow past that page because it's not letting me get out of it. So I'm going to go to the. See, I'm stuck in it. How do I stop it? Stop the video. Maybe that'll work. No.
Nope, that just took away your video. So if we, there we go.
Got it. I didn't know why it wasn't going. So just to give you a little bit of background, and I do apologize, but I've never worked on WebEx before. So this is the first. In 2018, we received the grant from ACL, and it's to help prevent Medicare and Medicaid fraud among seniors in New York State. So Senior Medicare Patrol empower and assist Medicare beneficiaries, families, caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. And how does it work? Excuse me. Our program works through community outreach, educational presentations, distributing information. We have a growing corps of volunteers throughout the state who serve as the eyes and ears of their communities and disseminate materials about their program. We also have certified unbiased counselors who provide assistance to the public and work with the U.S. Office of the Inspector General to resolve cases. One note about one of my volunteers, she was the first in the nation to report a scam. We'll talk about that one later. In all the states and in Guam and Puerto Rico. So it was really great. She shared that information. We got information out to the public. It was actually on Facebook, on a sheriff's website. It was on MS News. It took off all over the place, the advertising for it. So I was very happy. She actually lived in North Country. Who would have even known that they would have heard of this scam? Way up in, the Adirondacks, but she did, and she let us know about it. So very happy. I'll talk to you about that one later. So what is Medicare fraud? Medicare fraud is the key word that we're looking for is intentional. So it's intentional billing of Medicare for services that were not received or billing for a service at a higher rate than justified. Medicare abuse is really providers supply services or products that are not medically necessary or that do not meet professional standards. We get many phone calls where people say they went to the doctor, and even though they're not diabetic, they're saying, well, why don't you just get some equipment? It's free. It's not free. Medicare pays for it. But let's test you every day just to make sure that you don't have diabetes or there's nothing going on. Or you don't really need that wheelchair, but I think you could probably benefit from it. We know that people who don't really need wheelchairs, maybe those who are just using a walker, really don't necessarily need to go to a wheelchair. We want them to keep up their ability to walk rather than sit down. So a lot of times providers do that, and then they find that they can get away with it because Medicare will pay for it, and then it becomes fraud. So there are many, many, many types of Medicare fraud. I'm going to talk about just a couple on here. So one is ambulance fraud. I bring this one up a lot because I know everybody just looks at their copay. You get the bill and you have maybe independent health and you have a $250 copay and you pay it. But nobody looks at all the details in the bill. So the bill might say they traveled 100 miles when we know that here in Buffalo, everything is probably 8-10 miles away. So there's no way if you were in Amherst and they took you to ECMC that they went 100 miles. We also know that a lot of times they bill for a higher level of care than you need. So for example, if you have a broken arm, you do not need a paramedic. You do not need that advanced life support. If you're having a heart attack, obviously you're going to want a paramedic on board because they're going to hook you up with the IVs and do all the things that you need in order to survive and keep you stable until you get to the hospital. Medical identity theft. I just had a lady, she's 92 years old, who basically somebody used her Medicare number, took an ambulance to go to the hospital, was in the hospital for 10 days under this other person's name, and then she passed away. So this lady unknowingly gets a statement from Medicare saying that she went to the doctor like shortly after this lady passed away who was using her Medicare number, and they denied the service. Medicare denied it because she had already expired. And it clearly said on her MSN, service was after death, service denied. So she called me up and she's like, hello, my name is, and I'm 92 years old. And she said, do I sound dead to you? And I'm like, no, you don't. And she said, well, according to Medicare, I'm dead. Well, what happens with that? If you're a senior and you only live on Social Security, Medicare notifies Social Security that you passed away. So if you don't take care of this issue immediately, there's a risk of not receiving your Social Security payment every month, right? So this lady, fortunately, she thought it happened like really quick. We were able to call Social Security, prove that she was still alive, and then we were able to get money back to Medicare from the ambulance service, from the hospital, because they all billed Medicare with her number. I had another gentleman who moved and never reported his new address, and Medicare said he was dead. It took 3 months for him to get his money back from Social Security. So for 3 months, he had no income because the only money he had was Social Security. So it's really, really important when we look at the whole scheme of things of what's going on when they call you about those free back braces or durable medical equipment, like a walker, a wheelchair, the diabetic equipment. You really have to pay attention to what's going on. Because once someone uses your medical identity, we need to get it back to what it should be versus what the hospital just thought this lady's name was. And then when she died, they have a death certificate saying she had died. And it causes a lot of problems. Other one, home health care. Many people have aides that come to their house. And sometimes they're late, sometimes they leave early, sometimes they don't come at all. But yet they want you to sign their timesheet. So we're finding, or at least I found, a lot of times with consumer directed, when it's their daughter, their granddaughter, their niece that's helping them out, they don't want to say they didn't work. Even though maybe the laundry didn't get done, nobody went grocery shopping or did the things that need to be done. So both parties are actually committing fraud because you're signing off on a timesheet saying that person was there, right? And that person is asking you to sign that sheet for work that was not done. You have to be really, really careful. So even if it is a family member, you really need to be honest and say, no, you did not work. And I can't sign that time you were not here. And that's very difficult, and I realize that. Prescription drugs. I have gotten phone calls regarding pharmacists who short people medication. And usually it's oxycodone. It's a narcotic. And they go home with what they think is a 30-day supply of pills, and maybe it's only a 20-day supply. And the same pharmacy has done that to other people in that area too. So you really have to be careful, and you need to, before you even leave the store, especially if you're on a narcotic, is count your medicine at the store. Because once you leave, it's your word against the pharmacist's word. And there's really not much you can do about it. The pharmacist is going to tell you that the pill count in the store, they received 30 days. And the person's going to say, well, no, I don't have 30 days. I only have a 20-day supply. So if you take that type of medication, count it at the store before you leave, and make sure you have the exact amount of drugs that you are supposed to have. All right, next. All right, these are old scams. They've been around forever, but they all have a new twist. Excuse me. So before the pandemic, people saying that they were offering genetic testing were found at health fairs, senior centers, and they were at a table and they would say, we can do some genetic testing to see if you have cancer, if your medications are working with your system. We know when you get older, your medications work differently with your body. Really, all and truly, they would take a cheek swab, just throw that stuff out. But they really wanted your Medicare number because sometimes, somewhere down the line, maybe a year or two later, they're going to use your number for other things. The reality is that genetic testing is only covered by Medicare if it's a colonoscopy for cancer screening. So it's not a cheek swab. And if you do need a genetic test, that is only something your doctor can order because of the rules in Medicare. There's strict guidance as to what needs to be documented in order to get a genetic test. So if you see people or anyone calls you, because that's what they're doing now, they're calling you and mailing you a kit and telling you to send it back, say no. Just don't do it. If you really think you have cancer, go talk to your doctor. And if you're worried about how your medications are interacting with your body, talk to your doctor, not somebody at a table at an event who just really wants your Medicare number. All right, durable medical equipment. Those used to come via form of phone calls and postcards, right? So now they're just showing up at people's doors. They're not even calling you. So people are coming home, or they're looking at their door, and on their porch or whatever is a box with different braces in it. And in the box now are forms that they want you to sign saying you received them. The reason that is that they now have your Medicare number. They've already gotten it from wherever. There was a big data breach in New York a while back with the hospital system. We're not hearing what information was stolen, but I can only guess based on the explosion of cases that we're receiving. So what happens is if you get these boxes, if you come home and you get these boxes, or someone then other than your doctor called you, talked to you about braces and you want them, I want you to call our office. I don't want you to sign any of these forms. We're going to walk you through whatever steps are necessary to get the braces off of your history, your medical history, and report all of that information to the Office of the Inspector General. Like who sent it to you, where are you sending it back to? We need all of that information because we want to give all of the people involved in investigation the information that they need in order to get this to stop. So please, and if you do return them, the thing is, if you don't call us and I can't call Medicare and report it as a scam, you're still going to have a bill. You're going to owe your 20%. So you need to finish up with us so that we get the braces returned, we get an investigation going, and that you don't owe 20%. Medicare card scams have been around forever too. You know, you used to be able to get, like, if you want them laminated or the gold card. Now, you know, and then our Medicare numbers change, right? So we went from our Social Security number to a computer generated number. There's a lot of scams around that. Now, because of COVID, they're calling and saying you can get a new black and white COVID-19 Medicare card. You are not getting a black and white COVID Medicare card. It doesn't exist. You are not getting a new card, period. They're also calling about cards with chips in them. So you could like put it in a machine and the chip is red, like with a charge card. Well, Medicare is not going to give you a plastic card with a chip in it. They don't need to. Doctors can go into the Medicare system and they can pull out your Medicare number if you don't have your Medicare card on you. So, and they're not going to buy chip readers and plastic cards to do this when they can just look it up in the computer. So if anyone calls you about new cards, it's not happening. If they tell you that your benefits are going to expire because you're not going to get a new card, that's a lie. That's not going to happen either. The only way your benefit expires is if you pass away or if you go back to work, right? So say you're 70 and you got a job and you don't need your Medicare anymore because you have insurance through your employer. But yeah, don't fall for any of the, you know, black and white COVID. It doesn't exist. So what I want you guys to know is all of these scams are part of a bigger picture. So you might hear so-and-so got a phone call about a genetic test and somebody else got something about durable medical equipment. But all of these little scams, and they're not little, they're very expensive scams, are all part of a bigger picture. So there are these teams, they're called Strikeforce teams, and they consist of the Office of the Inspector General, the FBI, Department of Justice, Office of the U.S. Attorney, and local law enforcement. They have shut down healthcare fraud schemes around the country, arrested more than 1,000 criminals, and recovered millions of taxpayer dollars. Currently, they operate in 15 big fraud cities, including Chicago, Los Angeles, and Brooklyn. In New York State, Brooklyn is the largest area of Medicare fraud, but it does exist throughout the state. There is, oh my God, the indictments, the criminal actions are absolutely crazy. number wise, but I want you to know that in New York State, taxpayers lose over $5 billion a year to Medicare fraud. Over $5 billion a year. And that puts the Medicare Trust Fund at risk. So in 2020, it was September 2020, there was a scam that was investigated for about 4 years, and it targeted Medicare and Medicaid beneficiaries involving kickbacks, bribes, durable medical equipment, labs, pharmacies, in exchange for durable medical equipment, genetic testing, prescription drugs that are medically unnecessary. 345 defendants were charged, over 100 licensed medical professionals, covering 51 judicial districts, involving 175 Health and Human Services and Office of the Inspector General agents, and recovered over $6 billion in alleged losses. One of the things that's interesting to note about this takedown is they put it under the umbrella of telehealth. And we'll talk a little bit about telehealth in a little bit. But the way the scams worked were the doctors never saw these people. This was all done over the phone. They would get a phone call saying, about a back brace or you need rehab. So instead of going to rehab, though, we're going to give you drugs to make sure that you keep coming in for counseling. We're not going to wean you off your drugs. We're going to send fake samples to lab to prove that you're still chemically dependent. It was just a really crazy scheme that happened. I read some of the court papers. I was like, oh my God, I thought it was crazy. So this was a really big one. And then the Strikeforce team in Brooklyn had an investigation that lasted over 10 years. They were indicted in August of 2020. It was a healthcare kickback and money laundering conspiracy. And these people were ordered to pay $23 million back to Medicare and $16 million to Medicaid. So let's talk about what's going on with the coronavirus and scams with that. All right, so telehealth, pre-COVID, there was about 15,000 beneficiaries each week that received Medicare telehealth services. Telehealth was really geared for those people who lived in rural communities who could not drive within 15-20 minutes to get to a doctor. And this was a way that a doctor was able to maybe monitor them a little bit more because they had a medical condition that needed it. Maybe they were hooked up to monitors for their blood pressure, diabetes, or whatever else. And this was just easier for them than coming into a big city to have to go see a specialist and a doctor. During COVID, CMS, the Centers for Medicare and Medicaid Services, added 144 telehealth services. So that included things like your mental health counseling. It also included emergency room visits for people who did not feel comfortable going into the emergency room and needed to speak to someone. And then that person that you spoke to would tell you, yes, you really need to come in, or I think you'll be okay. You just need to follow up with your doctor tomorrow. I think in a lot of ways it's really good, but telehealth scams already exploded before COVID. Now with 144 new services, we know that it's really, really going to grow into a bigger problem. So between March and October, over 24.5 million beneficiaries received a Medicare telemedicine service. A lot of people chose to not go to the doctor's office and go on phone or via Zoom to talk with their doctor because they didn't want to be exposed to maybe getting coronavirus And I think it was a great service and definitely needed during the pandemic so that people could stay safe. Unfortunately, what it did was it also opened up the door for more scam artists to call you and say, hey, this is your doctor's office calling, and I'd like to schedule an appointment. And I know even some of my staff have said to me, well, I have like 3 doctors. I would have just said, oh, okay, what time? And would have went without saying, well, what doctor are you? Where are you calling me from? One of the things that we want you to do regarding telehealth, if you would really want a telehealth visit, is to make sure you call your provider and schedule your appointment. So if you call your doctor's office and they say, I can schedule you in Wednesday, 1 o'clock, whatever, then you know you can write that down because you know your office, your doctor's office is going to call you and you're going to be able to, they'll send you a link if you have a cell phone or whatever, so that you then can join your doctor. And if you're going to see your doctor, not someone you don't know, and you're going to be able to talk with them. So if someone calls you and they want to offer you free testing, treatment, supplies, hang up, it's a scam, and do not give them your Medicare number. Your doctor already knows your Medicare number. They know your address. They know your date of birth because they are your doctor and they have your file. So people that are asking you that, saying they're from your doctor's office, hang up on them. That's not your doctor's office. All right. So how to protect yourself from telehealth fraud. We want people to definitely review their Medicare summary notice and their explanation of benefits for improper billing and items that appear that you didn't order or receive. I know that research showed that only about 44% of people read their Medicare summary notice. And a lot of times when you do finally look at it, it's too late. You've been charged for a lot of things that you might not know about. It's really important to even use a healthcare tracker or personal healthcare journal. That way you can write down, this is my appointment. I went to this lab. I spoke with, whatever it might be. And you can compare what's on your Medicare summary notice is to what you have written down in a record book. So you could say, I did not go to that lab, or I did go, but I don't understand these codes. Any of those things that you can call your doctor's office and say, I don't understand these codes. What did I get billed for? Or you can call my office and we'll look it up for you. I had a gentleman call me who lives in the southern tier. And wherever he went, they send all of his lab work to a place in Pennsylvania. And he called me up and he was adamant. He was not in Pennsylvania. He hasn't been in Pennsylvania in years. He barely gets out of the house. And I called and I talked to the hospital where he was at. And they said, oh no, we send all of that to Pennsylvania. We're affiliated with them and they do all of our specimen samples. They do the testing. So I had to call him back and say, well, maybe you didn't go to Pennsylvania, but your blood went there. And they actually do your testing and they read everything about your lab work. And then, but if you don't know and you don't call and you don't have it written down, like I did not go that day. I know where I went. I had my blood work taken at. Why is it going there? And sometimes, it's better to even have somebody else check it. But the healthcare tracker is the one great way to use to compare your information. We have healthcare trackers that you can call our office. I will give you the phone number at the end. I'll be more than glad to mail you one if you want one. They're a great tool to have. So one consequence of the pandemic is contact tracing. Contact tracers did not exist before the pandemic. Nobody called you up to see how you were feeling every day and where you were, your location. Excuse me. But this was just a natural consequence, all right? So contact tracers trick anyone who might have been infected by a person who was recently diagnosed with COVID-19 to prevent further spread and or exposure. Well, scammers just jumped on that, right? So they just said if they called and said they were contact tracers and they want your information, they're really not asking you for the information that a real contact tracer would ask you for. And I'll go into a minute. So anyway, they try to steal personal information using email, text, or phone calls. You will get an email from a contact tracer if they cannot get a hold of you. If you're one of those people who really don't answer the phone, if you don't know the number, they will send you a text then and say, we're trying to get a hold of you. But contact tracers, their phone numbers are usually from the Department of Health. And it should say New York State Department of Health when they're calling you. We also know that if you live in Erie County, for example, someone calls you and says they're a contact tracer, hang up. Call Erie County Department of Health. Ask them if this is a contact tracer. And if it is, call the person back. If they say no, well, then you have your answer that was a scam call and do not call that person back. So real contact tracers do not ask you for money, your bank account number, credit card number, to click on a link in a text or email, your immigration status, Social Security number, or Medicare number. They will ask you, though, your name, your address. They usually ask for your date of birth, but you could give an age instead. So if you want to say, okay, I'm 45, right? You don't have to say the actual date you were born. Whereabouts on certain dates. And the reason why they're asking that is because you might have infected people. So they want to kind of get a general clue as to what's going on and where you've been. Questions about your health. And they're not going to say, does your back hurt? Do you need a back brace? Or does your knee hurt? I can send you a knee brace. They're going to ask you questions about symptoms related to COVID-19. So if they ask you any other questions, hang up, it's a scam. And that's not going to go away for a while because we are not going to be, we're still going to be using contact tracers for quite a while yet. All right, so this is a survey that my volunteer had reported, and it's a scam. And it's really not a Medicare scam, it's a financial scam, but it's a fantastic scam because as you can see, the cover picture that we have on here is actually a very generic one. But shortly after the generic one came out, now the scam flyers are either from Moderna or Pfizer. So they kind of like narrowed it down a little bit more because maybe you had one of those doses from Moderna or Pfizer. So that might attract you more to a very generic picture. This vaccine survey wants you to hurry up and take this survey, and you're going to win a prize. It says up to $1,200, $1,220, right? $1,220. Free survey, and they ask very generic questions. Have you been vaccinated? Are you planning on being vaccinated? Which one did you take? But they always give you like, I don't want to answer. There's like 5 answers. Yes, this is what I did. And then at the very end, they take you to a page where you can choose your prize. All right. So they have iPads, they have earbuds, they have nutritional supplements, all kinds of different things. And the reason why I know this is because I had to do it to see what it was about. So I clicked on all these little links to find out, So the prizes are really only about $99, right? They're not really this $1,220. And before you can even, if you pick what you want, you can't even do anything else but enter your information. So the information that they really want is your credit card number, your debit card number. Now, the one lady that called me about this actually did the survey, and she's a nurse, and she worked at the VA. I was very surprised she did the survey. And luckily for her, she used a credit card. So she was able to call her credit card company and she was able to stop, because what happened was they took $45 out for this, $20 out for this. They made about $1,000 of charges on her card before she went and looked and said, oh my God, this was a scam and I shouldn't have done it. And she was able to dispute the charges. Now, if it was on her debit card, like her regular bank card, that money would have been gone. And it was a longer process to dispute and get her money back if she did get her money back. So I'm not telling you to go on this and use your credit card, but I'm just letting you know, if you click on something, use a credit card, because then you will be able to stop it much sooner if you need to dispute it than if you use a debit card. So don't give out your personal information, and we always want you to click on the links by hovering over them, because scammers put more in the link, but it's in white and you have to really look for it. So if you see an email address and you want to know if it's legitimate, if you hover over it, you'll see more, but it will be in white to show you that this is not a legitimate link. There's just so many scams out there that you just have to be so careful. And you have to be very careful with all of your information, not just your Medicare number. Vaccine card scams. I was just talking to Katie about this yesterday. So they're selling these now for $9 a pop, $9.99 I think it is, on eBay. And one of the people that is selling it, and I can say this because there was an article, is actually a pharmacist in Chicago. All right, so he has an eBay account. And what he's doing with these vaccine cards is on social media, everybody who got their vaccine, taking pictures with their card. And on your card, not only is your name, is your date of birth, and then the lot number of the vaccine that they gave you. So for those people who don't want to be vaccinated, for $9.99, you can buy a card. It already has a lot number on it. You just have to put your name and date of birth on it. And if people are checking, there you are. You have your card. You're vaccinated. What that does, though, is it puts everybody else who was vaccinated or waiting to get vaccinated at risk. Because if you're going, let's say you go to a hockey game and you need to be vaccinated, or you need proof of a negative COVID test, if you go and you show them a fake card, they're going to enter you because they don't know if it's a fake card, right? It has a Health and Human Services seal on it. But now you're going to be with all these other people who vaccinated and could still get sick from COVID, because the vaccine is only supposed to make the symptoms less, not so drastic, right? So you're risking the lives of other people. And it's a really horrible scam as far as I'm concerned. You know, like Trader Joe's, you can go in now if you're vaccinated without your face mask. Well, who knows? Is somebody at the door? Let me see your vaccine card. I mean, is this like something we have to carry like a passport forever? We don't know. So you need to be really careful around people, and you just don't share your information. If you got your vaccine, I applaud you. That was something you wanted to do, and that's good. But don't share it on social media, because people are there and they're stealing all of that information. All right, so if you suspect Medicare fraud or abuse, we would like you to contact the New York State Senior Medicare Patrol. It's free and confidential. Our phone number is 1-800-333-4374. Also, if you would like a healthcare tracker mailed to you, you can call that number and we will get you one. I'm always looking for volunteers. I have about 57 volunteers throughout the state right now, but I'm always looking for more people who might be interested in giving a presentation or staffing exhibits at table and events, and we are opening up So that will be happening again soon. And we also have people that just share information. They belong to certain social groups or whatever, and they bring our information and share it with people. So whether it's a flyer, that kind of a thing. So to contact us, you can do it online at nysenior.org, or once again at 800-333-4374 to report suspected fraud or abuse, for training, speakers, and or materials, or to volunteer with the SMP program. So before I close and get into if there's any questions, I also want you to know that I did in the chat put a link for a survey. So if anybody on the call could click on the link and take the survey, I would greatly appreciate it. I do not see the survey. It goes right to AC Health. So it's not like I even get to look at it and see if everything was okay. So if you have any questions, I'm going to stop sharing my screen and go back to my site.
Okay, thank you, Beth. That was a really wonderful presentation.
You're welcome. So hopefully some people got some good tips here.
Oh, I think so. And we have a couple questions. So the first one, and I'm kind of interested to know too, is were you able to find out how the woman got the 92-year-old's Medicare number?
That I don't know, because the woman who stole it passed away. And that's not something that's not part of my investigation. My investigation is the very preliminary stages of what I report and then send to the Office of the Inspector General. So basically what I do know is the ambulance company got the person's information from the hospital. So somehow at the hospital there was a screw up or whatever. And how the deceased person got this person's info, I just don't know. My big goal was to get her alive with Social Security so she would continue getting her monthly income, and then getting Medicare to be reimbursed, because this bill was probably about $70,000 just for the hospital for the 10 days. And one of the interesting things too is there's a bill because the doctor at the hospital looked up her medical record because they thought they were treating a lady who had the same medical problem. So I don't even know. She could have been very easily confused medical records being treated improperly. We don't know. And that is something that really and truly could happen. If your medical records say that you take oxycodone, 10 milligrams a day for some pain that you have, and now you're in a bad car accident and you go to the hospital and you're in pain and you're already taking 10 milligrams, they're going to give you more, right? Well, you don't take oxycodone. So if they give you 20 milligrams, that would cause a lot of damage to you. So it's very important that, to make sure your medical records are accurate and say precisely what's going on with you. So even if you get a back brace, for example, and Medicare pays that $1,500 for that back brace, now you've injured your back and you need a proper back brace that you've been measured for and fitted, you're not going to get one because the Medicare just gave you one. So even something as small as the back brace that was fraudulently obtained needs to be taken off your record, or you're not ever going to get a proper diagnosis or treatment that you need as long as other things are on there. So unfortunately, no, I do not know how she got her number and or how the hospital got her number and how the woman sold it.
Wow, well, good thing you were there to really help her put back together the pieces so she could resume her life and her finances.
I know. Well, and that was my bigger thing. It was like, oh my God, she's got to get paid, need that income. So we did that first. It was like the big thing. Okay, we're going to get on the phone. We're going to call Social Security.
Oh my goodness. Well, the next question is, how can I opt out of these spam calls or scam calls?
All right, so you could, call the do not call number, and you could also get a service. What is it, like No More Robo? The reality is that really only affects legitimate businesses that are calling you. I mean, you should still do it, but American businesses will, if you're on a do not call, will adhere to that. It might take 30 days or so that they'll get you off their calling list. But scam callers, they're going to call you anyway. They're going to always be calling you. They're going to be spoofing numbers so that it looks like they're calling you from next door. Um, they're not going to stop. The only thing I can always suggest to people is just don't answer the phone. I mean, quite honestly, if it's your children, if it's your neighbor, you know their numbers. And if they really want to talk to you, they're going to leave you a message, right? They're going to say, hey, mom, I called, and you can call them back. Or they're going to send you a text. I'm like, my mother's 92, her grandkids all text her. But there is no way to legitimately stop the phone calls. I mean, you can go to Federal Trade Commission and report every phone number that's called. They'll be put on a list. Phone companies are now required, if a phone call is scammed, it's like a phished phone call, it'll come up on your phone and it'll say possible spam, right? But the reality is that even my husband, someone stole his phone number and kept calling this one guy. And the guy actually called my husband up and said he was going to beat him up because he was tired of my husband calling him. And my husband's like, some guy's going to beat me up because I'm calling him. And he's like, I'm at work. I'm not even calling him. And when we went to Verizon, they just don't have the ability to stop those calls. They don't have the ability to stop those phishing things that are going on. So, if you want to get No More Robo or whatever else is out there, go ahead and do it. But you really and truly are the only one who can stop the calls by not answering them. Because once you answer, you're a live wire. So you might not talk to anybody, but that scam company is gonna sell your information to another scam company. So they're never gonna stop. They're not gonna stop. Sorry.
No, that's okay. That's why we do the education. And while I wait for another question to come through, I have one for you, Beth. So
Sure.
say I answer the phone and I'm engaging with this person because I think it's my doctor's office, and then I give them my Medicare number because they want to verify something, and then I realize it's not a good call, it's shady, and I hang up. What should be my next step?
Call me.
Okay.
Call me, because what we'll do is I will flag it as a compromised number, and then I will have that person call and do the things that are necessary, and definitely read that MSN and the OBs to make sure that nothing's showing up. The thing is that most of the scammers are smart enough that nothing's going to show up right away. So even though they took your number, it might be a year or two before they decide to use it for something else. So you have to be diligent in reading those and checking them. The best thing though is to call me. I will tell you what you need to do. I will tell you where you need to call and take care of. It's just like a financial scam. Who do you call first? What do you do? So we'll walk through the process and get you where you need to be.
Okay, thanks, Beth. And that actually gave us another question that came in. Okay, so this one is, can you talk about how to make sure a provider is approved? I had a friend who got billed because a person on the surgery team was apparently out of network.
All right, so that is a definite CMS question, but it's a Medicare question. Providers are approved, they're not approved, they opt out. They have a right to opt out because they want to be able to charge you a different rate than what Medicare is going to pay for them. It's just like with the health insurance plans, like 1 week, one company is in, and then it says, oh no, I don't want to be in anymore because I don't like going through the rigmarole to get approvals or whatever. So the best way to do that is to just call. If you know who's going to be in that operating room with you or procedural room, you need to call ahead and find out if they are approved. Unfortunately, you get billed for everything. You get billed because I said hello. You get billed because I said goodbye. They looked at your paperwork. And unfortunately, there's no way to, like every day keep on track, but I would at least call ahead of time and say, is this a Medicare approved provider? And because I'm going to have surgery or whatever it is, and I want to make sure that, Medicare will pay their 80%. So that way you can make a decision too, like, oh, you don't want that person there, and to look around for someone else.
Okay, thanks, Beth. I'll just give it another second here to see if anything else comes in. And while we're doing that, do you want to give your phone number again? Because we do have a couple folks calling in, so they can't see your presentation. But if you just say your phone number.
Okay, so you can call me directly at 1-518-275-8812. And for those of you that are on the meeting today, if you can click on that Survey Monkey, I would greatly appreciate it. We're doing survey season right now for ACL.
And I just put that in the chat again. I just copied and pasted. So if you look at your chat, it might have that red dot, so you know how to access that. So I'll give you all a second if you want to pop that up. But otherwise, Beth, I'm just seeing thank yous. I'm seeing thank you for the information today. I feel more prepared. Thank you for all that you do for our community. So thank you, Beth.
Thank you. Have a great day.
You too.
Bye.